Hey, internet friend, welcome to Synergy Cafe. And I've got a friend of mine hiding in the green room. And I'm here in friendly Fridley, which is the armpit of Anoka County, right here just north of Minneapolis, Minnesota. And if you're from anywhere in the world, you probably hear things about Minneapolis. We're kind of a popular city right now. So I'm going to go to the green room and go find my friend Geno, and he's going to share some of his knowledge and wisdom. So if you want to stand by, I'll be right back. Don't go nowhere. Hey, Geno, how you doing?
I'm doing awesome. Fantastic to infinity times 8. Isn't that what you say? Or
I do say that. I'm wonderful and a half and then some to the 10th power of infinity.
Well, you got a couple notches better than me, that's for sure. I gotta amp it up a bit to catch you.
Couple notches. It's infinite.
It's infinite. Well, you're times 10. I'm only times 8. So
I probably haven't seen you since the Stone Arch Bridge Festival.
yes, when you and your lovely wife stopped by and we were looking at some of the cool art they had. They did have, that was one of the festivals that had nice art. They were doing a lot of Star Wars and animals and a variety of good stuff. So yeah, it's good seeing
I
you.
like that one. I kind of wish the Uptown Art Fair would come back, but they canceled that with all the craziness. Anyways.
Edina Art Fair is still going on 50th of France. You know, I'll be at that one because that's only.
We go to those. We go to the Stillwater one and the Wayzata one and the Minnetonka one. It's fun.
Well, you missed the ice sculptures in Stillwater this weekend.
I don't know. That's too cold. You
Yes.
got to have battery operated mittens.
Or socks.
You got socks.
Yes. Yes, I do.
So I don't do these real long. I try and keep these down to about 20 minutes, but if you got a lot more information, we can go longer. And then what I do is I take this video and chop it into little shorts using some software that I've got. And I have this software available because I'm an affiliate for that software if somebody wants to use it. Hint, hint. So we're going to talk about this Essential Health Plan. Geno, what can you tell me about Essential Health? Because
Essential Health Plan. Yes, it's the name of our company. We're out of Jacksonville, Florida, and we're the largest provider of what's called a SIMR, Self-Insured Medical Expense Reimbursement Program. And it's a government program, and it's really there to provide high-quality medical services so we can catch things before they become, big catastrophes in the medical industry. And so we're trying to reduce the spend of all these big, huge catastrophe medical stuff. And that's what it's designed to do, among other things. But
is that done through like preventative maintenance kind of thing, like taking care of yourself, which a lot of people don't do?
Absolutely. Yep. Preventative health, preventative maintenance through medical benefits. So it's, doctors that have over 10 years of experience that you're dealing with. So you're getting Mayo Clinic level medical services for your employees. And so this is a company thing. And it's interesting. Not a lot of companies know about it. And it's got this hockey stick growth going on right now because, the medical field is getting more expensive and benefits between now and next year are estimated to rise between 6 to 7%, which is the largest increase in the last 15 to 20 years. So a lot of these Ozempics and hospital bills are going up, and that's what's making it health, go up as well.
So the people we're talking to right now are employers, and how many employees do they have to have?
Yep. So to qualify for the program, they have to have 9 full-time employees. Full-time is 30 hours, or more. And there's a couple qualifications. I actually have some slides that I could show the doctor about that.
I will go get those for you. So that could be even like construction companies in some of these places that do windows, doors, siding, and all that. They might have more than, how many employees did you say?
9 or more.
Yeah, that's not. Well, here's your slide right there.
Okay. Yeah.
Expanding benefits, reducing taxes. Yes, we all want to reduce taxes.
Yeah, this reducing taxes is a great opportunity for businesses to increase their cash flow, increase their profitability, put rocket boosters on their EBITDA, is what we like to say here in our company. And the reason this program exists because we've got this huge bill of $4.9 trillion. That's 15,000 per person. So the government came up with new tax codes in the wellness programs and benefit programs for companies to implement that really support reducing that 4.9 trillion.
Okay.
And it's called a SIMR, self-insured. Oops. Oh, hold on there. Getting my highlight all. There we go. Self-insured medical expense reimbursement program. And the technology wasn't around before to make this all happen, but now it is. So we have a company, we're an exclusive provider of Revive Health, and Revive Health has over 5 million members. So they're really able to pay their doctors quite well. And that's why you get the quality benefits at no cost to the employees, which most companies can't believe. So it's all about proactive wellness. That's kind of the key. And this is buried in the Affordable Cares Act, I believe on page 3040. And so we use what's called the 105 cafeteria plan. I'll go through the requirements here, or actually the compliance. And there's two things. Let me switch over to this and this. These are the two codes that are most important. This is a 125 cafeteria plan, which has been around since the 1970s. But this is the new one right here, this 213.d post-tax. And that is what gives you the capability of implementing medical benefits and making them tax deductible, these preventative medical benefits. And so I ain't going to get into all of that kind of minutia. How you qualify, though, is important. They can't be 1099 employees. They got to be W-2. They must have health insurance. So they have to have a primary health insurance, either through their company, their spouse, the government, because the medical benefits that we provide are not like hospital stuff. This is all lower level office visits that we do that are all on the preventative side.
Okay.
So it's not, in lieu of, it's in addition to. We kind of like to call it the cherry on top of your medical benefits. So you have to have 30 hours of work and, be full time. And it's a all-in-one platform. So instead of going all over to these different locations for your medical benefits, it's literally an app on your phone. And so it's got 5 pillars: urgent care, primary care, medication, weight loss, and mental health. And us Vikings fans, we need the mental health stuff.
Okay. I'm not a big football fan. That's why I've still got my sanity, right?
Yeah, right? Okay, exactly. And so it's, 24/7 availability. Here, let me switch over to this. And I kind of covered everything. Easily scheduling as far as the time frame goes. So, for example, we do, if you like your primary care doctor, no problem. You keep them. You can go to them as much as you want. But we also have a primary care doctor. The benefit of ours is, they're available here in 1 to 3 days, opposed to most primary doctors are 3 to 4 weeks on average. So It's quicker appointment times. It's very high quality care. And the best part about it is there's no out-of-pocket costs with ours. It's similar to a gym membership. Your company gets these tax benefits, and then they pay your gym membership, and you can use it as much or as little as you'd like. So it's definitely something here that is valuable for employees, because when your employees are healthy, they're more productive, less absenteeism, stuff like that. Also, we've got a lot of customers in Colorado that go skiing and do crazy stuff. So we've got urgent care. It's something that is fast. They can triage anything. They can basically say, hey, this is just a minor bruise or cut or infection, and they can write a script and you just go pick it up. Or, they can say, hey, man, that's more serious. You need to go to hang up and call 911. So you're out, you've got a doctor right there, families, because this is good for not only the employee, but all the employee's family up to 5. So, if you got kids that are out doing things, this is definitely handy to triage anything that's going on if there's an emergency. Pharmacy solutions. We own our own pharmacy, and we just make all the different, brands that are medications that are most popular. I don't have a list of those. My coworker does, and so he, I could get that from him. But there's thousands of different that you get for free. Thousands of different medical pharmacy stuff.
So are you hooked up with places physically you can go to, or is it all done through the mail?
Yeah, it's great question. Thanks, Brad. Yeah, you just ship it through the mail, or you can actually, if the doctor writes the prescription, then you can pick it up at your pharmacy.
Oh,
and yeah, so you got a combination of either getting it in the mail on the regular basis, or if the doctor prescribes it, you just go pick it up at your pharmacy. And then we got mental health, like I mentioned, 24/7 master level clinicians. You can also set up times with them so you can, have sessions. And mental health is a big thing nowadays. People are having a lot of stress, especially in our lovely hometown of Minnesota here, and stuff going on. So it's nice to have somebody to talk to if you need to, and they can go from there. Weight loss. What's key about this is I have a friend who lost 108 pounds. You've heard of these Ozempics before?
Yeah.
This is the only thing that's not covered, but it is highly discounted. Is we've got an oral contrave, we've got these semi-glutide trizepatides like Wegovy, Ozempic, and they're like 1/4 the cost of what you would pay at a prescription here in the United States. So we get these from Canada, and so that's why they're so cheap. We've got a contract with Canada, and that keeps these prices down. And so it's really a program where you can track what happens in your company. Like every time somebody goes to the doctor, there's a medical code that gets produced. And what this does is it tracks all that. And so you can look at your employees and see how much care is going away from their primary, because what this is trying to do is reduce the cost of your primary medical benefits by diverting all of this lower level health care to our app. Therefore, as time goes on, your health care goes down in price because you're using it less. That's similar to like if you had less speeding tickets or accidents on your insurance, your car insurance would go down as time goes on. So that's one of the main benefits. Number one, it's a tax saving strategy. Number two, your health care goes down as time goes on. This is how it all works. Now, do you want me to get into the magic of this, or do you want to skip
magic?
Yes.
I had a question in my head, like how are they able to do it less? Is that because a lot of your stuff is more of a digital, where some of the places have physical brick and mortar facilities that they have to pay for?
Yeah, it's all in a tax saving strategy. So this particular situation, the membership to Revive is $149 per month. But in this case, with the new tax saving strategy, this particular employee is saving $309 off their taxes, because we were able to implement with that 213.d, we were able to take away $1,220 from their gross pay. So that reduced the cost of, here, let me show you this, get my handy dandy arrow thing. That reduces, instead of $318 in federal withholding, they're only paying $242, and so on and so forth here, as you can see. So instead of paying $513, or instead of paying $822, they're only paying $513. So that's where the employee can pay for this membership of $149, and that $160 left over gets put to their check, so they're able to actually increase their paycheck by 4%. So not only do they get high quality benefits, they get a 4% raise by implementing this program. So it's a win for the employees, it's a win for the company, and it's a win for the healthcare system. So I'm focusing on cannabis companies right now, as I mentioned earlier, just because I know cannabis companies are hit with other tax difficulties because it's not federally legal, but I can do any type of company that has 9 employees or more.
Okay.
So that's where the magic happens, Brad, is all in the tax savings. Everything we get paid, we have a $40 fee that we charge, but even with the $40 fee, they're still getting a 4% raise in their paycheck. So it's good for everybody.
Okay. Are you done with the screen then now, or?
Yes, except for I want to just get this one last part here. Basically, it starts with a discovery call where they learn about it. Then we collect a census to see how many employees qualify, and we give them exact numbers down to the penny on how much they're saving per year. And it's usually, like I just did a cannabis company that had 28 employees. They're saving about $19,000 a year. So that's pure cash flow for them now. And we do all the education. So we get between 80 to 90% participation from the employees. So this program's great. Yeah, so I'm done sharing. I'm good.
Okay.
Yeah.
Cool. Well, how are people going to get a hold of you? Do you want me to put your phone number up on the screen, or you don't want to do that, or?
Well, yeah, that's fine. If you'd like to throw my phone number on the screen, that's the easy way to get a hold of me.
Just got to do the little snap my finger thing. There it goes. Look at that.
Wow.
That one right there, that's Geno's number.
There it is.
So any business that's interested in this program, you can contact Geno directly and talk to him right here at the World Nerve Center headquarters of Minneapolis, Minnesota.
I'd be happy to help you out, explain it in a little bit more detail, and see, who qualifies and how much money you can increase your bottom line by.
It's pretty cool.
Yeah.
I think there's a lot that's shifting that I've seen with some of these, the way things are being done. It's kind of fascinating. Like the AI thing has gotten bizarre, where you can create a graphic image in 30 seconds where it would have took 3 months to work with a graphic designer.
Right. And like
stuff that's happening.
K-Fan, the radio station, they create jingles within like a minute or two where they just input all the data they want, and then they'll play a song that's sports related or whatever related. And it's like, we just created that a second ago in this AI app. So
there were some people that were concerned about the AI taking their jobs away. But what's happening, I think, you're self-employed, right, through this company?
Yeah.
I think there's going to be a surge of people that are self-employed doing their own deal. They used to call it the gig economy.
Yeah.
But I think people are going to start going, you know what? I really don't like this 9 to 5 thing. I think I'm going to start doing something like I'm doing the affiliate model stuff. Is this something like that too? If someone
our company is growing rather fast, and they are looking for other people to represent this. And there's a healthy residual income available, because once we integrate this with their payroll, companies never unlock themselves, because why would they? They're saving money and they're helping their employees out. So the commission usually is good through until they get rid of it, which could be a lifetime. And
I was going to say, is it recurring?
Yeah, it's residual recurring every single month. Yeah, that's
how you can call Geno right there with that phone number right there and learn more about it.
Yeah, feel free to give me a text or a call and say, hey, I've got a company that has 9 employees or more, or whatever you're at. Or
if you're worth it to hire a couple people just so you can take advantage of it.
Yeah. If somebody's likes to talk to the C-suite or the head of HR, they I'm more than happy to work with people and train them in. And we've got a good team so far, but we're expanding by leaps and bounds.
Well, this is wonderful. Geno, I'm going to let you go into the green room. And what we did is we transferred all the stuff. We had digital hors d'oeuvres back there, and we made them even better now. They're all new and, like I said, low-cal, and they're all healthy. So you must appreciate that, the digital stuff.
Thanks for what you do, Brad. I appreciate you having me on, and I really get entertained by all the other people that I see, and you're doing a great job for businesses and people. So thanks for putting this on.
Well, I'll pop you into the green room. If you want to stick around, we can have a chat. But if you got to get going, I totally understand. Thank you, buddy.
Yeah, no problem. Have a good.
That's it. Well, I cut him off before. See how rude I was? I cut him off before he said, "Have a good day." And he was sincere about that. So there you have it. Spending the day at Synergy Cafe with me, Bradley G, and Geno. And here's his number once again, in case you want to call him. Give him a call, give him a text, and he's ready, willing, and able to help you out. So peace, love, and happiness. Enjoy the rest of your day. I want you to be good, be kind, and be nice. I do mean be nice. Okay? Peace. See ya.